years ago, so I think it's a great opportunity to be here. I was asked to give some inspirational comments, and I will tell you, after following Margaret, and she covered so many things that we do as physicians, I won't take up more time, but I do want to bring out a couple of things that I think are important. Last week I was in London at the International Conference for Physician Health, and sometimes we as physicians forget that the most important patient that we see is the one we see in the mirror every day. We need to take care of ourselves as physicians, because if we don't take care of ourselves as physicians, we can't take good care of our patients. So let's remember how important it is for physician health as well as our patients' health. I'm also the chair of the World Medical Association work group on physician wellness that we just started last year. And so I'm very much looking forward to get input on what do we need to do to make sure we as physicians remain healthy and confident to take care of our patients, because that's an important thing that we all have to do. I'll also tell you that the American Medical Association has 3 strategic goals that are very aligned with the physician wellness thing. We have, first of all, we're working to improve the health outcomes in our patients. We're going to tackle prediabetes and hypertension and cardiovascular disease as major disease entities that our patients are facing. Second, we're going to tackle physician satisfaction and well-being, making sure that our practices not just survive in the current environment, but we thrive in the current environment. And to that end, last fall, we did a study across the United States about what the satisfiers and what the dissatisfiers are for physicians. And number 1 on the list was making sure that we have an impact on the health of our patients. So the fact that we're trying to improve health outcomes for our patients is directly involved with our physician satisfaction. And the third strategic goal is to improve medical education for the future physicians of tomorrow and make sure that we put in place team-based care, competency-based advancement, and understanding of how to use technology to improve the care of our patients. So we're very interested in making sure we do all of those things that will lead to the better well-being of our physicians. And the last thing I want to say is that as this is a meeting of physicians, and I commend all of you coming together to share your insights, what's working and what's not working, what are the challenges that you're facing in your individual countries. I hope we also always remember, because we oftentimes as physicians talk about all the things that are bad in medicine, all the things that are challenging about medicine, let's also remember that we are privileged to be physicians. And we're in a very honored and noble profession. Sometimes I think we forget that it's important that we as physicians remember what an important place we play in society. I often tell people that in the United States, there's a very common saying: is there a doctor in the house? If there's a problem, if somebody faints or gets sick, or there's a fire, they often call for physicians. We're different than the other professions in that they ask for us all the time. It's not very often anybody says, is there a lawyer in the house? Or will an MBA please come to the back of the airplane to help us? You don't hear that very often. But they do ask for physicians in those places, because physicians are different than other people in society. We run towards problems, not away from them. Whether the problem is a natural disaster like an earthquake or a major health threat like Ebola, we as physicians run towards those problems, not away from them. And that makes us different as physicians. And we should stand proud because of what we do for society and what we do for the rest of the world. So as we join together in this CMAL convention and share the issues, the problems, and the challenges that we face as physicians, let's not forget to celebrate the special place that we have as physicians as well. So again, thank you for the opportunity to be here. I look forward to hearing from all of you and talking with you and learning from you. But thank you for the privilege to address you this afternoon, and I hope you have a great meeting. Thank you very much.